right, good morning, everyone. It is time for our weekly visit with our favorite family physician, Dr. Stan Anderson. He is on our WHBC Newsline right now. Good morning, Dr. Stan.
Hey, Pam, great to talk to you.
All right, so you're going to make us talk about something painful again. Arthritis.
Yeah, so one of the interesting things is about 1 in 7 adults in the United States deal with this. It's the fourth leading cause of disability around the world, and it's something that is so ubiquitous. When somebody says, oh, I have arthritis, nobody says, oh, what is that? Everybody knows what arthritis is. It's discomfort in the joints, it's stiffness, and it's something that comes on gradually and gets worse as we get older. So, yeah, it's one of those things where the joints are affected, and literally almost any joint can be involved. So it's not just the knees or the hips, but it can be in the hands and the fingers. And so we end up looking at people that come in and they say, my hands are just stiff, and they got these nodes, and those are oftentimes called Bouchard's nodes, where they're in the middle joint of the finger, or if they're in the furthest joint of the finger, they're called Heberdine's nodes. And these nodes are basically the side effects of the osteoarthritis, which is causing damage. And so it ends up being something that people lose muscle, they can't function the way in which they used to, they have a hard time getting up, they end up just having their life significantly negatively impacted because of their inability to be able to do what they used to do. And with this being Hall of Fame week coming up, the issue is that most of the football players, because of the trauma that they've been through, have arthritis somewhere. So I thought, okay, because of Hall of Fame, let's talk about something that all of those greats are going to be dealing with later on in life, and that is arthritis, what's called osteoarthritis, which is the wear and tear type of arthritis of people as we get older.
Yeah, that's one of the first things I ever noticed when I met Hall of Famers or interviewed them is like, and I hate to put it this way, but like their fingers pointing in different directions and being bent and, different things like that, because obviously, from all, like you say, all that wear and tear of the years of playing football.
Yeah, and what we don't really talk about this that much is what is it that they had to sacrifice in order for them to end up being able to play the way in which they did, to perform the way in which they did. And at the time, it might not have been that much, but now that they're in their 60s or 70s, arthritis is so common. And so, yes, it is, and it is difficult because you remember these players when they were in their prime, and then when you see what they've become because of the arthritis, it really is it takes you back.
Is there any way to prevent it from happening?
Yeah, so the research on that is not nearly as good. The short answer is you want to take care of yourself. So if you have an injury, get the injury completely cleared. You want to work on your flexibility. You want to work on your strength. You want to work on your ability, your endurance. The more that you end up gaining weight, the more likely it is that that's an issue. So people who have jobs with a lot of stress level on their joints. So if you do something where you're constantly bent over. So on the baseball team, the catchers are the ones that have the most amount of knee arthritis. And it's because of being in that crouching position for such a long time. So some of it is inherited risk. So if everybody in your family had arthritis, you're likely to get it. But the most important thing is flexibility and stretching and exercise. That's something that really, really does help.
And then once you have it, I mean, I know I have, we get older, it starts to occur, so, but as you get age, it gets worse and worse. But how do you, make yourself feel better once you have it?
Yeah, so there's everything you can think of is out there on the market. So you end up getting a lot of spam emails about nerve excitation and all sorts of supplements that are being sold that say this is the cure for arthritis, or you need to try our supplement. Look how many people say that it's wonderful. The problem is a lot of those things, so a lot of those claims are completely unfounded. So the most important thing, if you're struggling with your weight, try to lose weight. It is the weight that puts pressure on the joints. The things that you can do are stretching and exercise. The more that you work on the muscles around that joint, the more likely it is that it's going to get better. And oftentimes medications play a big role. We talk about Tylenol as being one of the things that helps. The anti-inflammatories also give some improvement. But really, from a pragmatic point of view, it's therapy. It's the things that you do that basically work on helping you to manage the discomfort. The physical therapists are probably the best. People have wonderful experiences with chiropractors, and they really, really do help. But if you're not doing something on a day in and day out basis, you're going to end up having it get worse. So as good as those are, you've got to focus on doing what you can. So swimming, walking, strengthening, working on range of motion, all of those things are just so vitally important. The things that don't work as well, there's no data that going with massage therapy helps with arthritis. It helps to decrease the pain of the muscles around it, but it doesn't necessarily help the arthritis discomfort. One of the things that we recommend is for people that have significant mobility, using a cane so that you don't fall. What you don't want to end up taking something that's bad and making it worse. So the more your arthritis progresses, the more likely it is you're going to be unsteady on your feet. So what you don't want is you don't want to end up making something bad terrible. And then we talk about joint replacement or joint fusion. So in people that have bone on bone and their pain is horrible, that's something where we say, yeah, you probably should see the orthopedic doctor and get that surgically taken care of. But the issue is, just because it's bone on bone doesn't mean that you're going to have a certain level of pain. It's the functionality. It's the flexibility. I have some people that are bone on bone, but because they're so active, their pain is minimal and it's well controlled. Other people with minimal arthritis by the x-ray, they are hardly able to move. So it's individual, the way in which the arthritis affects people. The most important thing is do the things, talk it over with your healthcare provider, get into physical therapy, start working on yourself. Do the things to make you the best person you can be. Strengthen, stretch. Physical therapists are really good at helping you to work through that.
All right. Lots of good advice there, Dr. Stan, because I don't think there's anybody who hasn't said, oh, yeah, I have arthritis, especially as you get older, when you start talking to friends and family, it's prevalent. It is. It really is.
It's so tough, and there's so many things out there that are complete shams. So make sure to talk it over with your healthcare provider. Sometimes joint injections really do work. So whether it's steroids or whether it's the hyaluronic acid, those are the things that oftentimes help. But again, you want to talk it over with your healthcare provider.
All right, sir. Well, we will talk to you again next Wednesday. You have a good one.
Hey, thanks, Pam. You too.
News, sports, traffic, and weather all morning long on your home.